Rome Memorial Hospital delivers compassionate, connected care for every stage of life.
The compassionate, connected care speaks to our responsibility to be sure that we take care of all of the patient's needs and the family.
I'm Jessica Calmurray. This is Nora. She's almost 7 months old. And then we have Jack, who's about 3.5. And then our oldest daughter will be 6 next month. So when we were pregnant with my first daughter, I needed to find an OB. And I heard great things about Dr. Desai and Dr. Jistra. And they delivered here, and I was nervous because it was a little out of the way. But we have such a small patient base that my experience was amazing. Anything I could have asked for, they let me labor the way I needed to. They never made me feel rushed or like I needed to opt into pain meds or I needed to do anything that was uncomfortable for me. And our nurses up here are fantastic. They keep you moving even when your body says, I can't do this anymore, I'm too tired, and they know, it's going to prolong your labor if you don't keep up and keep moving. I know it's tiring, but they're so encouraging and they're so knowledgeable about their profession. I couldn't have asked for something better.
I am Leah E. Mobersteg, and I have been here for a little over 2 years. That was actually a large portion of why I wanted to work here as well, is our extremely low C-section rate. I think a lot of people seek that out because the care in a natural delivery and the recovery is so much shorter than that of a cesarean section, and people come here knowing that they are given every possible opportunity to have a natural delivery before it comes to a C-section. We can cater to your needs and try to do every different thing that we possibly can with induction and labor to just sort of avoid the C-section and try as many things out so you can have a natural delivery and we can get the baby right to your skin post-delivery. It still amazes me. I'm like, okay, this live thing is on your chest and it's crying and it was just in your belly, and it just, you see hundreds and hundreds, and it just doesn't ever cease to amaze me.
I fell and broke my leg in a couple places, and I have muscular dystrophy, so I couldn't walk. So I came to keep myself walking after I was done healing, and I was really afraid I wouldn't be walking again because of the muscular dystrophy, but the rehab is excellent enough, so I'm pretty convinced that I will be walking probably in a couple of weeks. My son got married this past Friday, and I thought I was not going to be able to go, but they came down and arranged for a bus to pick me up and take me. I left here at 3:30 in the afternoon. They came and got me at 10:30 at night at the wedding venue in Vernon, and they were wonderful. I mean, they made sure I made it. They made sure I made it home. They and that's one of the amenities of being in rehab here.
So Denise came to us with a lot of challenges. From her past, she had muscular dystrophy on one side of her body, so she had a lot of weakness on that side, and on top of that she had a hip fracture, which she had repaired, but due to her weight-bearing restrictions, we had some issues as far as being able to get her mobilized again. One of the best things about Denise was her motivation. She was very determined to get back home. She still is, and she works very hard every day in therapy to try to achieve those goals of getting home again.
My name is Joseph J. Palermo. Well, the reason I came here, I had to have surgery on my lung, and in doing the research in the areas, I found that Rome Hospital has the best, actually zero infection rate for surgery, and the surgeon I picked happens to be a Johns Hopkins graduate with his PhD. You don't get any better credentials than those.
Rome Memorial Hospital is a special place because we do care for friends and family, our community. We're dedicated, committed to them. We provide health care across the spectrum. We make certain that we base our health care in evidence-based practice, which means that we don't live in a vacuum. We do make certain that we do our due diligence, the research, and that we are providing our patients with the best health care possible.
Well, after the surgery itself, I was in the ICU, and the care, the nursing staff was absolutely wonderful. They were there for me whenever I needed anything, and I couldn't have asked for more attentive care and more compassionate care.
Patients come in with questions. They have family members who have questions, and I always try to imagine that the patient is a family member and that I would take care of them as I would a family member.
I think the difference at Rome Hospital is the family atmosphere. We are employees of the hospital, yet we are also users of the service. We are patients and we are providers.
That's very important to us, that we invite into our family of coworkers exceptional people, people who really want to be here, who want to deliver health care in a way that matches major health centers.
It was the best experience that I could have asked for.
Rome Memorial Hospital is on a path to grow. We are continually investing in this organization, from the development of our IT department and the use of our electronic medical record to the investments we placed in women's health and women's imaging with our 3D mammo machines and other technology that allows us to grow that service line. We continually look for opportunities to support this community, to grow and be responsive to the needs of our patients in Rome, and our goal is to be a greater asset to the community of Rome and the surrounding areas.
We pride ourselves on our department. We work really hard to make this the best department that you could possibly find anywhere. And that means we have well-trained technologists, we have excellent equipment, we keep up to date on all of the things we need to do to provide the right level of care for the patients of Rome. If you look across the board, we're the complete imaging department. We can do almost anything here, and that includes wide range of MRI imaging, CT imaging, ultrasound imaging, plain film imaging, and a fair amount of intervention. With regard to breast and women's imaging, we have the most complete department that you will find anywhere in the area. This is a great hospital. This is a hospital that acts like a family, interacts like a family. We work together, all for a common goal, and with administration, physicians, and staff, you don't see that a lot, but you do see it here.
We've earned that Breast Center of Excellence recognition based on the teamwork approach that we have. From the minute a patient starts with us till they're finished, and those are very stringent standards. The radiologists have to meet standards, the staff has to meet certain standards in the imaging quality.
Senior Behavioral Health is a pretty unique unit. It's geared for adults that are 55 and above, and it is those that have comprehensive psychiatric problems. We do a lot of things, from diagnosing dementia, treating depression, schizophrenia, bipolar. As the population ages, we see that the mental illness doesn't go away because of the aging process. Actually, at times it becomes a little bit more acute and sometimes a little bit more reticent to treat. So we have a specialized unit that will actually treat the elderly population with mental illness. Because they're elderly, they're much more fragile. Things such as falls that we don't worry about in the general population are things that we are very concerned about in the elderly population. And so the staffing ratio is a little bit higher. We have family meetings, and at any time they can ask us for information. We keep them abreast of everything. It's totally transparent. The whole process for us, and the whole idea, is that the quality of life has improved. When they come in and they're agitated, irritable, or having hallucinations, or depressed, or feeling that they're at the end of their life cycle and don't want to live like this, and they go out the door being happy, looking forward to engaging with their families, even trying to start new hobbies, or even engage in old hobbies, it is really satisfying to see that they have progressed from a point of there is nothing left for me, to a point that I can do anything that I want to do as long as I have the support. And that is gratifying, and it's a good feeling to see that you have helped somebody.
Community Recovery Center, CRC as it's known, is a place where patients with addiction issues can go to for medications and counseling, 2 services under one roof, and that is very good for the patients. It helps with their cravings, and it helps to prevent withdrawal. We have some patients who are freshly coming off a heroin addiction and they're going through withdrawal. If we give them these medications within an hour to 2, their withdrawal symptoms are minimal to non-existent. And those who are in maintenance therapy, it gives them a peace of mind, in regards to not having to go out there to get a high because their cravings are taken care of. Yeah, the opioid epidemic is rampant. It's everywhere. And in Rome, of course, you guys know we have a lot of deaths from heroin overdose and other prescription drug overdose. Definitely, drug addiction can take over a person's life. I've seen it. Well-established professionals can really lose everything because of drug addiction, lose their family and job and their life.
And one of the most important parts for our patients during their treatment is that they lie in the same position each day. The easiest way to achieve that is for them to be comfortable physically and emotionally as possible. This particular patient had some real anxiety problems, and we, through talking to him in his first few visits, found out that Spider-Man was his favorite person in the whole world. So for this guy, because his favorite person in the world was Spider-Man, we allowed him to turn into Spider-Man each day for his treatment. And it just helped him feel like a superhero, like he could get through this and he could conquer this disease. So it was fun to see him come in each day and see him happy about getting on the table and turning into Spider-Man each day.
A lot of times, coming to the wound center, you don't know what to expect. So a lot of times if you have a wound that either isn't healing or it's very slow to heal, we like to see you within those 4 weeks, because generally if you're pretty healthy, you've got a good immune system and no other really serious medical issues, that should start to heal up within about 4 weeks.
Pulmonary rehab program, we've been here for quite a few years, since 2008, and it's a program of exercise and education that's designed for people that have lung disease, usually a chronic lung disease. The most common one we deal with is COPD, but we also deal with people that have had lung transplants, people that have pulmonary fibrosis, cystic fibrosis, any chronic lung disease. Most people that come to us are pretty short of breath doing almost all activities, and they just want to get back to some level of normalcy. It might be something as basic as being able to drive a car again. And so we work with them, set goals with them, and try to make things realistic. When I talk about the program to people, they're very frightened at first because they think we're going to put them in and make them exercise nonstop for an hour right from the beginning. That is definitely not the case. We start very slowly. Every person is different, and we evaluate what they're able to do in the beginning and then slowly increase that. They may spend only a few minutes on a machine such as that called the New Step, maybe 2-3 minutes the very first time they do it. By the time they're done, most people are doing 15 minutes or more on that machine and a total of almost an hour of exercise.
The fact that the Sleep Disorder Center is located in the hospital gives us lots of advantages over other sleep labs. We have the whole hospital as our resource. If something should happen to the patient during the night and they have chest pain or shortness of breath, we can always call a nurse down or the emergency room physicians down to help the patient, to assess the patient. The reasons that people need a sleep study is usually to rule in or out sleep apnea. And what we do is we hook them up to the machine and we look at their breathing and see if they stop breathing during the night or if their oxygen levels fall. We also test patients for narcolepsy and look at restless legs and insomnia. Well, if you don't go into the different 4 stages of sleep, that can affect every organ in your body. There are 4 stages, and a lot of times what happens is if your oxygen levels fall or if you stop breathing, it wakes you up out of maybe the first or second stage of sleep, so you never get to the third stage or REM, which is important for you to function during the day, to have energy during the day. You need those 4 stages of sleep. So we designed the sleep center to mimic that of a hotel to make you as comfortable as possible.
Everyone here is an owner. Everyone acts like an owner, from our environmental services professionals who might clean your room, to the doctor who comes in later and sits down and explains your condition. We all want to make your stay here the most comfortable it can possibly be.
Our commitment to the community is to provide the best health care that's possible. Our commitment to quality extends throughout our entire organization.